Indeed so. This morning we've heard submissions by the Netcare Group representatives talking about the regulatory inefficiencies that hampers costs in the private healthcare but also in the public healthcare system. We've also heard from the Netcare Group that there isn't that much of a difference when it comes to operating costs for private healthcare as well as public healthcare. But now joining me to speak and to summarise exactly what we've heard presented to the Commission here this morning is Sipu Ntombeni. He is the Health Market Inquiry spokesperson. Sipu, good afternoon to you. We've heard from Netcare various representatives talking about what hampers the cost or what contributes towards the rising or the high costs of healthcare, not only in the private sector but also in the public sector.
Yes, what Netcare gave today in their presentation was to explain to the panel what are the factors that really are driving up costs. I think one of the issues that they really highlighted is the cost of labour and the cost of the nurses that they're having. Part of that, when what exacerbates those costs, is the fact that there's a shortage, according to them, there's a shortage of nurses and properly qualified nurses, and this is because of the restrictions in regulation about the training of nurses. So that's one of the things that they put to the panel's attention today. They've also talked about a number of factors, including the employment of doctors. There's regulations that restrict the employment of doctors by hospitals, and that's one of the things that they've put to the panel as an issue that they would want to be addressed by this inquiry.
We do know that just now, in about an hour or so, Health Minister Aaron Motsoaledi will be making his submissions, or the department's submissions, to the inquiry as well. This is the first set of these public hearings. What happens after this?
Yes, as you correctly point out, this is the first set of the public hearings. We closed them off with Dr. Motsoaledi. After this, we will have 5 other sets of public hearings. Each of them have a specific focus. The second set is set to take place at the end of March, but communication will be sent out regarding that. And each of these sets will talk to specific issues that have now come out. And I think some of the stakeholders in these first set has talked about some of the issues we will be taking a further look at up till June.
Now, we know that these hearings and this inquiry has come about because of concerns by the public and also other sectors of exactly how expensive it is to access healthcare, medical care in South Africa. When all the submissions have been heard, when all sets have been completed, what would then be the work or the outcome of this inquiry?
Yes, the work of the inquiry would obviously then to crystallize all of this analysis and all the work that we've done, come up with our findings and put those findings to the public. We would also then be responsible to come up with recommendations. I think Netcare even touched in their presentation today about the recommendations that the inquiry would be making. So that's basically what will happen at the end after these hearings. Is that the inquiry will then come out with some recommendations to the sector and to players in the sector as well.
Thank you very much, Sipu Ntombeni, speaking to us and just giving us a summary of exactly what had transpired during this morning session when Netcare made submissions to the inquiry. We do expect Health Minister Aaron Motsoaledi to make his submissions to this inquiry at about 2 o'clock this afternoon, and that would be the submissions from the Department of Health. Back to you in studio.
Vanessa, thank you very much.